Hi, I'm Charlinda Bennett, and I'm doing physical assessment here on my patient, Mr. Bennett. First, I will wash my hands to prevent infection. Hello, how are you doing today?
I'm doing pretty good.
Can you tell me your full name?
My name is Nicholas Scott Bennett.
Do you know what day it is?
It is March 7th, 2019.
And do you know who the president is?
Donald Trump.
Okay. Patient is alert and oriented times 3 to person, place, and time. His speech is clear and understandable. He's calm. His mood is appropriate. His speech is appropriate. Um, at this time, um, I'm going to go ahead and ask you, I'm going to tell you 4 words. I want you to try to remember them later. Happy, flower, dog, and car. Would you like to repeat that back to me?
Happy flower dog car.
Okay. See if you can remember those later. Do you know what time you came in for your appointment today? Do you remember what time?
11 a.m.
Okay. Patient's recent memory is intact. I went ahead, got Mr. Bennett's vital signs. His blood pressure was 122 over 74. His temperature was 98.5. Respiration 16. Pulse 80. They're all within normal limits. His heart rate is within normal limits. Regular rate and rhythm. Normal sinus rhythm. No problems with tachycardia or bradycardia or anything like that. You can feel free to ask me questions at any time during this assessment, and I'll maintain your privacy and your confidentiality. So at this time, I'm just gonna check his skin here. Skin looks warm, dry, and intact. Feels warm. Nose is midline. No signs of any lesions on the face. Eyes in the upper third of the face. Mouth is in the lower third. Looks symmetrical. Head is normal cephalic. Any tenderness?
No.
Hair is short. It's dry. Scalp is white. No lesions, no scaliness. No signs of any type of parasites or nits. At this time, I'd like to test the cranial nerve number 5, trigeminal. I'm just going to have you close your eyes for me and just let me know when you feel any sensations.
Yep. 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 Yep.
Okay. I want you to clench your teeth down for me a couple of times. And again. The masseter and temporal muscles are strong bilaterally. The trigeminal nerve is intact. Next, I'd like to check the facial nerve, which is cranial nerve number 7. Can you frown for me? Can you smile really big? Can you puff out your cheeks? Okay. Facial nerve is intact as evidenced by symmetrical facial expressions. No drooping at all. Right now, just going to check your nails here. Patient's nails are clear, trimmed. They're translucent, convex, less than 160 degrees. Capillary refill is less than 3 seconds bilaterally. And now I'd like to go ahead and check his eyes here. The sclera is white, the eyes are brown, eyelashes are averted, they're evenly distributed, the eyes are symmetrical, The eyebrows are present, they're coarse, no scaliness, no lesions. If I wanted to check his cranial nerve number 2, which is the optic nerve, I would use a Snellen eye chart. I'd have the patient stand 20 feet away from the Snellen eye chart, and I would cover the right eye and have him read the chart, cover the left eye and have him read, and then have him read with both eyes. But also do a color discrimination test. That's where you have colored dots. You have a number of color dots within a background of color dots to check for color blindness. And then now I want to check his cranial nerves number 3, 4, and 6, which are the oculomotor, trochlear, and abducens. And I want to check his extraocular motor and the cardinal fields of gaze. I just want you to look at my pen light here and just follow it with your eyes, but don't move your head, okay? Okay, good. So the abducens, the oculomotor and trochlear, they're intact. Also want to check his pupils real quick. Usually you dim the lights. I'm not going to dim the lights because the lights in this room are really dim and I actually can't really see the size of his pupils. So I'm going to go ahead and leave the lights on. And they went from like a 4 millimeter to about a 2 millimeter. Also the consensual light reflex is present. Okay, I just want you to stare here, this light. I'm going to bring it in. His eyes converged. So his pupils are equal, round, reactive to light, and accommodation. Now we'll go ahead. I would like to have you cover your nose here on one side and sniff, and cover the other side. Okay. His ears are patent. And also, if I wanted to check his olfactory nerve, cranial nerve number 1, I would actually have him close his eyes and include each side and identify an alternate smell. But does your sense of smell work pretty well?
Yes.
Okay. Yes. I'm going to go ahead and check your frontal sinuses. Any tenderness?
No.
Or maxillary? Any tenderness?
No.
Okay. Now I'm also going to check his ears and the mastoid process here. Any tenderness here?
No.
Just going to press on the tragus here. Bilateral. There's recoil bilaterally. There's no signs of any lesions. I'm going to check here on the external ear. No signs of any drainage, foreign bodies. No signs of any drainage or foreign bodies on this side. The ears are symmetrical. Also, at this point, I want to check the vestibulocochlear nerve. It's also called the acoustic nerve. So I'm going to test the patient's hearing. Can you cover that ear for me?
Razor.
Cover that ear for me.
Shower.
Yeah. So the patient's acoustic nerve, cranial nerve number 8 is intact. He can hear. equal. You can hear the whispered sounds bilaterally. Now I'm just going to take a look at his neck here. There's no signs of any lesions, no nodules, rashes. The color is continuous as that of the neck. The skin tone overall is uniform, intact. And now I'm going to check your lymph nodes here. Pre-auricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, supraclavicular. Got a deep cervical chain. There's no swelling, no signs of inflammation. They're really not, they're non-palpable. And then at this point on, we want to go ahead and check his turgor. It's good, no tinting, he's hydrated. Also check his turgor here, his arm. No signs of any tinting. Skin remains warm. At this point, I'm going to check the carotids. That's strong, regular. The carotid pulses are strong and equal, regular rate and rhythm bilaterally. And now I'm just going to auscultate them just to check for bruise. No evidence of bruise noted. Now I'm just going to check for lung expansion. Just want to have you breathe in. Okay. Lung expansion is symmetrical. I'm going to check for tactile fremitus. Can you say 99 for me?
99, 99, 99, 99, 99, 99.
Okay. Tactile fremitus. Both the sounds, the vibrations on either side were equal. Now I'm going to just percuss the lung fields. And the tone that I'm getting is resonance. I'm going to go ahead now and listen to his lungs. You can just breathe normally like you usually do. You take a deep breath. And out. Deep breath. Another deep breath. You can open your mouth a little, take those breaths. Deep breath. Okay. Take a rest for just a second. Okay, we'll just listen to laterally. Okay. We'll check the lateral side on the right. that all right? Okay. I'm just going to have you turn this way here. You can scoot up for me. Okay, you can turn back around. Okay. Vesicular breath sounds were noted anteriorly. All lung fields were clear bilaterally with no adventitious sounds. At this point here, I would like to go ahead and check your mouth here. Lips are reddish pink, no signs of lesions, no cracks. Open wide for me. Say And I had a tongue blade, but my kids took it, so I would use a tongue blade for this. Can you stick out your tongue a little bit?
Uh-huh.
And say So the uvula is midline, rises and falls with phonation. The tonsils, there's no swelling on his tonsils, no exudates, grade 1. He stuck out your tongue. Hypoglossal cranial nerve number 12 is intact, as evidenced by the protruding tongue midline. You raise your tongue for me. The ventral part of the tongue has got a lot of shininess, blue veins. The mucosa is pink and moist. The hard and soft palate is continuous and smooth. There's transverse rugae on the hard palate. Soft palate is smooth.
Mommy.
The tongue is pink with some white to it and some papilla. But I would check the gag reflex if I had the tongue blade.
Not now, babies. Okay, please. Just wait, babies. Hold on, we're almost done.
Sorry about that. Okay, so anyway, if I check the gag reflex and check the mouth for saliva and the rise and fall of phonation, but anyway, I was checking for the cranial nerves number 9 and number 10. That's the glossopharyngeal and also the vagus nerves, and they're intact. And then I also would like to check the trapezius muscles and sternocleidomastoid muscles. Can you push against resistance here? Okay, good. And the spinal accessory nerve, cranial nerve number 11 is intact. Do you have any questions?
No.
Okay. That concludes our physical assessment. Thank you.
Thank you.